the views maker, sharing information, shaping perspectives.
Kerala, the only state in India with the experience of containing deadly viruses like NIPAH, now leads India's fight against the coronavirus. In this video, we take a look at Kerala's exemplary model, covered by India Today News.
That's right, lockdown or no lockdown. Welcome to this special episode of our continuing coverage Info Corona. The debate over the lockdown, some would say, is simply a non-starter. A lockdown is a must. The question is, how do you go about one? Today we are going to focus on Kerala, a state which has seen one of the highest incidents of coronavirus cases, but also seen an extremely proactive administration that's battling the health emergency, a state that has battled in fact in the past few years, including the NIPAH virus. Let's take a look first at how Kerala is the one state that perhaps is best placed to meet the corona challenge.
24 hours before India, Kerala had already gone under complete lockdown. The state with the highest number of active coronavirus cases as of now is pulling out all the stops to combat the virus. Starting midnight of 24th of March till the 31st of March, Kerala will remain under complete lockdown.
സമൂഹത്തെ കരുതി ഇത് തനിക്ക് വേണ്ടി മാത്രമല്ല തൻ്റെ കൂടെ ഇന്ന് നാട്ടിൽ ജീവിക്കുന്നവർക്കെല്ലാം വേണ്ടിയാണ് ഞാൻ ഈ ഒറ്റയ്ക്കിരിക്കുന്നത്, നിരീക്ഷണത്തിന് വിധേയനാകുന്നത് എന്ന ധാരണയോടെ ഇരിക്കാൻ അവർ തയ്യാറാവണം. അതിന് അഭ്യർത്ഥനയുണ്ട്. ഇത് അംഗീകരിക്കാതെ വന്നാൽ ഇനി നടപടികളിലേക്കും കടക്കേണ്ടതായിട്ട് വരും.
With this, Kerala joined other states across the country that have declared a lockdown to enforce social distancing and hopefully slow down the spread of the virus. The decision in Kerala came after 28 people had tested positive on Monday, and on Tuesday, the first day of complete lockdown in the state, 14 more tested positive. Monday also had seen the highest single-day increase in the state. It took the total number of active COVID-19 cases to 105 in Kerala. A total of 72,460 people are under observation, out of which 71,994 are in home quarantine and the rest in hospitals. Till now, only 4 individuals have been discharged in Kerala after they recovered from the illness. Kerala today has the highest number of active COVID-19 cases. This despite the state having a robust health system in place, which has successfully dealt with viral epidemics like the 2018 NIPAH outbreak in the past. Kerala was the first state in India with cases of COVID-19, and the state government kicked into action much before the centre and other states. It has high community resolve to fight back this pandemic. So why do health experts fear there might have been cases of community transfer in the state? Why is Kerala unable to stall the spread? We explain all this in this special episode of Info Corona.
Now, as COVID-19 cases in India today soar past the 500 mark, hospitals across the country are fearing a sudden spike if critical cases in the spread of the virus continues unabated. Let's take a look then at Kerala's health system, how it functions and what it is doing to flatten the curve in the fight against coronavirus. Take a look and then we'll talk to Kerala Chief Minister Pinarayi Vijayan and ask him where his state stands in the fight against corona.
As Kerala enforces statewide lockdown to curb the spread of coronavirus, it has also rolled out policies to counter the spread of COVID-19 and is preparing to combat the virus on a war footing. India still maintains that the virus is not yet spread via the community level, but there are apprehensions that it might happen in the days to come. A report by Kerala government's team of experts warns of a possibility of the virus infection spreading to nearly 50% of the state's population. If the estimates are correct, that would mean roughly 16.5 million people could test positive for the novel coronavirus. And this is being seen as a worst case situation. But for now, despite having the highest number of active COVID-19 cases in India, Kerala is leading the country in creating a treatment model. Till 24th March, 4,516 samples of suspect cases had been sent for testing, out of which 3,331 came back as negative. 12.1 tests per lakh of population, Kerala has the highest rate of testing in the country. The state has also announced hospitals will be opened in every district to deal exclusively with COVID-19 patients. Hostels in some districts are being turned into COVID-19 isolation wards. The Kerala government has also appointed 276 doctors in the health department to help formulate better medical policies in its fight against the pandemic. Kerala currently has 1,297 healthcare institutions in the government sector. These 1,297 centres have 39,511 beds. Apart from these, there are 12 ESI hospitals and more than 80 cooperative hospitals jointly managed by the government and private organisations. Together, these have more than 5,000 bed facility. The state's private allopathy hospital network has more than 1,500 medical institutions, which have around 60,000 beds. Kerala also has a vast network of government Ayurvedic and homeopathic institutions, which constitute around 20% of the total healthcare network. There are more than 5,000 doctors employed in the government facilities alone. This brings the doctor per bed ratio to 7.5, which is excellent compared to the national average. As of 24th March, 72,460 people were placed under surveillance by the state's health department. Out of these, 71,994 are under home isolation and only 466 have been admitted in designated isolation facilities.
So let's speak to the man in charge. A short while ago, I spoke to the Kerala Chief Minister, Pinarayi Vijayan. He doesn't come often before the media, certainly not the national media. This is his first interview to a national channel. In fact, he's been coming every day on the Kerala local media. Appreciate your joining us, Mr. Vijayan, here on India Today. My big question, do you have enough supplies? It's a question that is being asked everywhere. You're a consumer state. Given the lockdown, 21 days, how are you ensuring that people will get food and other essential goods, Mr. Chief Minister?
We are well equipped to deal with the situation. We have enough stocks of food grains and essential commodities, that is enough and more for more than 3 months. So the possibility of panic buying is also totally ruled out.
So you're saying you have enough stock to last this entire period, no problem with that. The other fear, Mr. Chief Minister, is that in the coming weeks, there will be an exponential increase in the number of positive cases. We've already seen Kerala's cases rise manifold in the last few days. Does your healthcare system have the capacity to meet the challenge if there is an explosion in the number of coronavirus cases?
Based on our experiences thus far and the steps taken so far, we do not foresee on exponential growth. However, we are geared up to meet any eventuality. Buildings are being taken over and systems are being put in place to ensure adequate quarantine, isolation, observation, medical assistance facilities. All these things are being done. Already 1,60,556 beds have been arranged and 20% of these have been specifically reserved for this. Additional beds are also being mobilized. Adequate number of ICUs, ventilators, etc. also are being arranged. As we are aware, we have clamped down a lockout all over the state on Monday itself. This is prior to the announcement of the national lockdown announced by the Prime Minister on Tuesday. We have done everything possible to see that the spread is curbed with these steps.
You know, it's interesting, Mr. Chief Minister, you're saying that you announced a complete state lockdown on Monday itself. That's a day ahead of the Prime Minister's announcement. You know, I said this last week, what Kerala thinks today, India thinks tomorrow. And one of the things that you've been pushing for is aggressive testing. You're testing more than most other Indian states. Do you believe that aggressive testing, as the World Health Organization suggests, is the right way forward? Do we have enough testing kits for corona? And is that the reason why we are not being able to increase the testing? Because at the moment, we still don't have enough testing kits.
Tests in Kerala is happening at a rate which is unmatched by any other state. In a health emergency like this, we feel that this should be expedited. Also, Government of India should decide on rapid testing as well, instead of the PCR tests now adopted. Approval of testing centers, etc. are done by Government of India. Kerala government has rolled out a rupees 20,000 crore special package to overcome this COVID-19 pandemic. It takes on inclusive view and ensures that no one is left behind. It covers a health package, loan assistance scheme, welfare pensions, MNREGs, free food grains, subsidized meals, tax relief, and arrear clearance. One of the major elements in this list is the loan assistance program. Loans worth rupees 2,000 crore will be made available to families with the help of Kudumbashree. The most important point with regard to this is that the interest of those loans will be borne by the state. Such loans have helped many families to make a comeback in the period after the floods.
Okay, Pinarayi Vijayan, the Chief Minister of Kerala, and we'll have much more of that interview later for you. It's an extended interview, but that was an excerpt. The Kerala Chief Minister, the one state that seems to be really getting coronavirus under control. Much more testing and much more effective public health systems there in Kerala. Welcome back. In India, the first corona positive case arrived in early February in Kerala. There were 3 students who were affected. Soon there were more cases. Remember, this is a state where a number of people live in the Gulf and other parts of the world, so there is a high possibility of contact. But Kerala has overcome that hurdle. Now Maharashtra has surpassed Kerala with the maximum number of corona positive cases. But there's been a spurt again in Kerala in the last few days. The good news though is this is the one state that perhaps still has the experience to tackle the health emergency. Quite simply because their public health system is the best in the country. Here's a report.
കൊറോണയിലൂടെ ഒരു യാത്ര. എനിക്ക് തോന്നുന്നു ഇന്നലെ മറ്റേ പ്രശ്നങ്ങൾക്ക് ഇടയിൽ കിടക്കുന്ന സമയത്തായിരിക്കാം മിക്കവാറും പ്രശ്നങ്ങളൊന്നുമില്ല. എന്റെ ഷെങ്കൻ വീസ അവർ ലെൻസ് വെച്ച് നോക്കുന്നത് കാരണം ഇവിടെ ഒരുപാട്.
He is the vlogger who was on a bike trip in Europe. At Azerbaijan, he had to drop his ambitious plans due to the outbreak of the corona pandemic and return to Kannur in Kerala. The vlogger, Ballu Traveller, was immediately taken to an isolation ward on his arrival at the Kannur airport. He tested negative and after 3 days stay in an isolation ward, he was released.
എന്റെ റിസൾട്ട് വന്നു, നെഗറ്റീവ് ആണ് കേട്ടോ.
The clean state-of-the-art government hospital service in Kerala has been its biggest weapon of defense against the spread of the corona pandemic. The first case of corona-positive patients in India was reported from Kerala in February. And within days, the Kerala government announced a state calamity. 3 students arrived from the epicenter of the virus affected Wuhan district of China. The first patient landed in Kochi from Wuhan. She was recommended to be in home isolation. Her condition was closely monitored by the health department officials. As soon as she developed symptoms, she was shifted to the nearest hospital with an isolation facility. Even before the test results arrived, the state government had identified others who had travelled with her. By the time she had tested positive, 2 other friends who returned from Wuhan were shifted to isolation wards in Alappuzha and Thrissur districts. All 3 recovered completely.
People might think that you will not be allowed to do anything, or it will be a very boring time over there. How did you spend time over there?
Actually, my isolation days was quite normal because I could use my phone. They provide me with Wi-Fi and all, so I could use social media and I watched movies. Yeah, everything was normal. Just we can't go outside. That's it.
Even after she was discharged from the hospital, the counselling team would reach out to ensure that the patients were emotionally stable. On March 8th, Kerala Health Minister K.K. Shelja announced that 5 new cases were detected in the state. The cases included a 3-member family which had come from Italy as the primary carriers and 2 of the relatives in Pathanamthitta. The family did not follow the home quarantine guidelines and roamed around for over a week. It created wide panic in the state as close to 3,000 people in Pathanamthitta, Kottayam districts were included in the primary and secondary contacts. Efforts by the district administration ensured that most people who came in contact with them were traced. 4 such people later tested positive. Similarly, many other patients who had come from various other countries were identified before they could cause a community spread.
ഇത് നേരത്തെ നമ്മൾ പോസിറ്റീവായി റിപ്പോർട്ട് ചെയ്ത കേസുകളുമായിട്ട് ബന്ധമുള്ളതാണ്. അവരുമായിട്ട് ആ സ്റ്റുഡൻസുമായിട്ട് ബന്ധമുള്ളതാണ്, അവരുമായിട്ട് ഡയറക്റ്റ് കോൺടാക്റ്റ് ഉള്ളതാണ്. നമുക്ക് എല്ലാവർക്കും അറിയുന്നതാണ്, ഇതിന് പ്രത്യേകിച്ച് മരുന്ന് കണ്ടുപിടിച്ചിട്ടില്ല. കൃത്യസമയത്ത് ഈ കാര്യം റിപ്പോർട്ട് ചെയ്യാനും ഐസൊലേറ്റ് ചെയ്യാനും ചികിത്സ കൊടുക്കാനും കഴിഞ്ഞാൽ ജീവൻ രക്ഷിക്കാൻ കഴിയും എന്ന പ്രതീക്ഷ തന്നെയാണ്.
Kerala has a record for having the most number of COVID-19 testing centers, and this is also the state where the maximum number of tests are done. During the NIPAH outbreak, Kerala had to rely on the National Institute of Virology, Pune, to get swabs tested. But 2 years later, the state has set up a satellite center of the NIV in Alappuzha approved by the ICMR. The state expanded the number of facilities with the help of microbiology labs in various hospitals and other research establishments. Now the state has 10 testing facilities across the state which are accredited by the ICMR. But a shortage of testing kits is slowing down the entire process.
We have very good planning earlier itself. As you say, NIPAH incident is a very good experience to us. With that experience, we have planned everything earlier. And all other departments are also helping us.
The state has already announced a package to tide over the coronavirus crisis. The Rs 20,000 crore package includes food for all through the public distribution system and loans worth Rs 2,000 crore through the Kudumbashri scheme. Another 2,000 crore rupees have been granted by the state government for employment guarantee program. It has also announced 2 months welfare pensions in advance. Equipped with the past experiences of dealing with natural calamities like the 2017 Ochi cyclone and the 2 consecutive years of floods and the epidemic outbreak of the NIPAH in 2018 and 2019, has put all the right measures in place to fight the corona pandemic.